Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. This has been a busy week full of lots of new COVID information, and many of my patients are confused about what all of it means and what they should be doing to keep themselves safe. The CDC this week recommended that even fully vaccinated people should wear a mask in indoor public places in areas of the country where the community transmission is high. That includes Dallas County and North Texas in general. They say that even if the number of new cases is not high in a particular region, people who are immunocompromised or at increased risk for severe disease due to underlying chronic health conditions, or people who live with someone with those risks, should consider masking in public places. The CDC also recommended that vaccinated people who are in close contact with unvaccinated people, including children under the age of 12, wear masks in public indoor spaces, no matter what the transmission rate is in their local community. This is all based on new data that the Delta variant is more easily spread from person to person than the other COVID-19 viruses, and because people infected with the Delta variant may carry much larger amounts of virus in their system and could spread that to others, even if they're vaccinated and even if they don't have any symptoms. This is why they've also recommended masking in schools for students and teachers, as has the American Academy of Pediatrics. Because of this information regarding Delta, there's also a change in the recommendations for what vaccinated people should do if they're exposed to someone with COVID-19. There's still no requirement for vaccinated people to quarantine at home or to not go to work after an exposure, but they should monitor very closely for symptoms for a full 2 weeks after the exposure and should get a COVID-19 nasal swab test at 3 to 5 days after exposure. They should wear a mask in public indoor spaces and even consider wearing a mask at home to protect their family if they're unvaccinated or high-risk people that live in their households until either 14 days after this exposure or until they get a negative COVID test result at day 3 to 5. The previous guidance was that vaccinated people did not need testing after exposure, but we now understand that that is important. You may have also seen new information released from Pfizer this week that a third dose of their vaccine leads to higher antibody levels than achieved with the 2-dose series. This information has not yet been published, nor has it been reviewed by other scientists for accuracy. And we also don't yet know if the higher antibody levels that are seen means less people will actually get infected. Some data from other countries suggest this may be the case, especially in patients with poor antibody response to the vaccines because of underlying immunosuppressive conditions, but we still need more data. Getting a third dose is not yet recommended or approved by the FDA or the CDC, but they're monitoring the situation closely. It's really important to remember that the 2-shot vaccine series is very protective against severe illness, hospitalization, and death from COVID-19. So the bottom line from all of this is that the Delta variant behaves differently than the other COVID variants we've seen so far, and we need to be more careful to protect ourselves and those around us. I was glad to see the CDC adjust their recommendations based on new evidence. If you are not vaccinated, now is the time. That is by far the best thing you can do to protect yourself against COVID. If you have any questions about the COVID vaccines or what you should do yourself, please talk to your doctor. We're here to help. Thank you.